Comments and viewpoints on this program are not necessarily those of station ownership, staff, or management. Welcome into the Patient First segment, presented by Excel Rehab and Sports, with locations in Easley, Clemson, and Seneca. Excel Rehab and Sports offers physical, occupational, and hand therapy. Being their best to make you better. There is a difference. It's their Patient First mission.
Good morning, and I have on the phone with me David Bright. It is the Patients First mission segment with Excel Sports and Rehab. It's first Tuesday of the month, and we love to do this every Tuesday. Good morning, sir. How are you?
Good morning. Good morning, Kevin. Thank you for having us on. We're going to do a call-in this morning with you since it's we're still having some restrictions on getting together and being in person. So having myself on with you, I appreciate this opportunity. We've also got Dr. Ted Swann on with us this morning. And I think
good morning.
Good morning.
Go ahead. I'm sorry. I didn't mean to interrupt you.
No, I think it'll make great sense for us to have Dr. Swann on with us this morning for the topic that we're going to be discussing this morning. So I think it'll work out really well. And that topic that we're going to actually be discussing this morning on that Patient First segment is, you know, as home and work restrictions are lifted related to the coronavirus, what's next and what do we do? You know, as Excel Rehab and Sports, we are considered an essential business during this time, and we have stayed open during the pandemic. We have patients in pain, and they've had surgeries and things like that, and they need help. And that's an important thing, but as the CDC has updated recommendations and we've modified protocols and what we're doing, we're trying to find the best way as restrictions are lifted to open back up safely and to do that in a way that creates some sense of normalcy. As Excel, we do physical and occupational therapy. We're not on the front line. We're not treating those people that actually could have an active case of corona. But having a person like Dr. Swann on with us, that's his expertise. He's been monitoring this coronavirus very closely. He's been updating his patients on what's going on with it. So as we start to lift restrictions, we as the business leaders in the community and as the community itself, I think it's going to be very important for us to determine how do we make that adjustment back and how do we create that transition back and do it safely and balance that aspect of not staying home so long that it affects our ability to have a normal life, a normal income, but also not be brazen and jump right back into things too quickly. So while we have Dr. Swann with us, I wanted to let him kind of speak a little bit to what we're seeing and what's kind of going on within the aspect of the coronavirus. We are having some outdoor dining opening up and having that aspect. So the ultimate question for all of us is, how do we return back to normal? And how do we do that in a safe way? So Dr. Swann, can you kind of lead into a little bit about where we are and how you see things making that transition back to normal as safely as we can?
Well, thanks to both of you for the invitation to be on. Let me just start by introducing myself and let your listeners know who's talking. I'm a primary care physician in Clemson, and so I'm not a physician that's been in the ICU taking care of critically sick patients, but I do own my own practice, and so I've had to do my best to figure out how to take best care of my patients during this time. And as we all know, as the coronavirus kind of loomed out there before it came into our communities, there really was no book to read. There was no resource. And so all the information that we had to work with was just emerging. And so that was really unsettling. And I've been paying attention to this for quite a while before we encountered it in the United States. And as I saw what was happening in Italy and how that system was becoming just completely overwhelmed, that really got my attention about what could happen. And, you know, a lot of times we can think about different countries being having characteristics that are not quite like us in the United States. But Italy, the region of Italy that was being affected, we have a lot of similarities with them. And so when we witnessed what was happening there, that just really got my attention about how bad things could get and how overwhelmed systems could get. And so that just really made me nervous. And I did everything I could to learn, and I have essentially been just absolutely consumed trying to do my best and learn about it. And, I've got a young family, and it really did worry me early on. Was I going to get sick dealing with patients, and was I going to bring that home to my family? So we had just an incredible amount of uncertainty going into this, very little information. But at the same time, we're in a much different place now, several weeks into having to deal with this locally. And one of the things that I have, speaking of locally, I have been very interested in what has been happening in our neck of the woods. So certainly interested in what's happening in our nation and interested in what's happening in regions around us, other states, how they are dealing with things. Our state, South Carolina, what the burden has been here, but particularly locally.
Doctor, can I jump in and ask you a question real quick while you're talking locally? Now, Monday the governor lifted those a lot of restrictions, the home or work mandate. That's been returned to like a voluntary kind of status, and he's allowing the restaurants to do outdoor dining. And in that, there is guidance that states each table should be at least 8 feet apart from edge to edge with no more than 8 people. Now, is that good enough? I mean, even outdoors, is that safe enough? Is that in order to start to return to a bit of normalcy, as it were?
Well, I think it probably is good enough. We're entering a new chapter, a whole new experiment. And the 6 feet social distancing does seem to be an effective separation. And as we're studying how disease is transmitted and seeing that it really is happening with closer contacts, if we are able to keep 6 feet distant from, kind of people that we would bump into just moving around the community, that is probably an effective distance. And I would imagine that the extra 2 feet just makes room for waiters and waitresses to be able to maneuver around. But I think that 8 foot separation is appropriate.
Now, is that something that people should be concerned about? You mentioned servers. They're going from table to table with drinks and plates and things of that nature. So would that be an item of concern?
Definitely.
And how would we approach that? I mean, how would we prevent? I mean, are the servers supposed to be wearing masks or glove? I mean, and changing the gloves every time they go from one table to another, because that could get kind of, frustrating, especially as a server.
Sure. Well, I can tell you, in our office, I have to be closer to patients than 6 feet.
Oh, sure.
When I'm with them, and I can do a lot of questioning. We can have a lot of discussions where we are separated by more than 6 feet. But in my office, we are wearing masks. And when we have patients come in the door, we ask them to put on masks. And in different settings, that may be more or less appropriate. I think an outdoor setting may be a little bit advantageous as to what might be able to be transmitted in 6 feet. But servers, anybody that is, part of this story is about connectivity. And any individual that comes into contact with many individuals is a real that's somebody that has to pay extra special attention. So, for instance, in my family, we are mingling around each other, but I am the biggest threat because I'm an individual. I'm the individual that has contact with many people. So a server is going to be somebody that has to be extra careful. However, the same principles apply. Wearing masks, keeping your hands clean, keeping distant from when you can, and the hygiene that goes into cleaning dishes, that all that really can be managed as long as somebody has the discipline to do it.
Right.
And I think this brings up a great point in talking through these items, because as we are making our way back out in the community, as we're moving back out, we want to know the answers to these questions. Is it safe? How do we do it safely? We know we have to get back out eventually, and we know we want to do it at the right time. We don't want to be the ones that do it in a way that creates more of a challenge, but we also don't want to live in fear, and we want to have that quality of life that each of us enjoys. One of the things, and I think Dr. Swann has done a great job of kind of describing for the restaurant industry some of those things that we have to do. I think that in being a patient of Dr. Swann's and being someone myself and being someone that follows his recommendations, I think we each have to accept that wearing masks is going to be something that's we've got to feel a little bit more inclined to do it, and we've got to accept it as the new norm for a while. And I think for a while is going to be the question mark. And as things have changed and as things evolve, the CDC's recommendations and everything, and just seeing how things are moving, we've got to be flexible. One of the things at Excel that we have done in just trying to create a safe environment for our patients is we have continued to create different levels of change for our patients so that they can trust us, so that they can walk through the door and say, okay, this is going to be a place that even though I'm a little hesitant, I can know this place is much safer than the drive-through restaurant where I'm going every day or every other day to pick up my food. This place is doing above and beyond the levels of sanitization, of everything that they can do. So everything as business leaders that we can do and we can think of without being absurd, I think we have to really be the ones to draw that line. And as Dr. Swann has said, wearing masks as waiters and waitresses, we've got to find those places that are taking this seriously so that we can make a safe return into the community, so that we can do those things we need to do and want to do without feeling that restriction, without feeling those limitations.
Indeed,
let me add on to that, because with David's physical therapy business, during these last several weeks, I've had patients that I've needed to refer. It was very important to me that I could confidently refer and know that his business was taking the extra precautions. And I wanted that to be essentially advertised at the front door so that when one of my patients came through, they immediately got the sense that this was a business that was taking the extra precautions. And so I think that if I'm out in the community and I have 3 restaurants to choose from, I'm much more likely to choose the one where it's clear that they are taking the extra precautions. So that is, I think that's an opportunity, and I do think that we can look at what our governor is encouraging or requiring us to do, but at the end of the day, the individual business owner will get to decide how they manage their particular business. And I think if they can give confidence to their community that they're doing it responsibly, that's going to be a place where we can feel better about being patrons. So, can I add just one little detail that I think is important for the community to understand? We all know that if you feel sick, you stay home. I think that is well understood. But there's a phenomenon with this particular virus that makes it unique from other things that we're used to dealing with, and it's really, to me, the hallmark. And that is that people can be contagious before they get their first symptom.
That's what I was going to ask you, Doctor, is, I saw a report the other day from the CDC that said that there are people that don't have symptoms and they're contagious, and they don't even know that they have the virus, and they're just out and about doing their normal everyday routine.
That's correct.
So,
and if we don't have a way to address that, this disease is much more likely to continue. So most people who are exposed, everybody's heard about the 14-day window where you have to kind of be extra careful. But most people become symptomatic between the 5th and 7th day of their exposure. So if you've been exposed and you make it past 7 days, the odds are starting to turn in your favor that you're not going to get sick. However, if I get symptomatic on day 6, I've actually been contagious. I'm contagious on day 3 to 4. So 2 to 3 days before my first symptom, I'm contagious. And so if I'm out in the community and I'm really mingling with friends and neighbors, and I'm closer than 6 feet, and I'm not taking that precaution because I feel well, this problem is going to continue because people who mean very well are going to be sick. And there's another phenomenon. I'm not sure if you've heard of this phenomenon that we call super spreaders. And so when you trace down the infections in a community, what you find is that there are people who become ill and they don't pass it on to anybody. But you might find another person who got ill and they infected 35 people.
Wow.
And that person is a super spreader. And as long as we have the opportunity for a single individual to infect many, the importance of personal responsibility, everybody doing their best, is just paramount for us as a community to be successful. And we really are so fortunate in this area, kind of the golden corner, with a very low incidence of disease. And that is to our tremendous advantage. And as we are released back into our communities closer to normal, if we can be disciplined to really do our part, then we can really thrive. But it is going to fall on the shoulders of each and every person in our community to do their very best. So I do worry a little bit about some of the sentiment that seems to be emerging, which comes from understandable frustration, which all the people have been through. But I certainly want people to take it serious, at least serious enough to do their part when they are out in their communities to be responsible.
Let me ask you this, both of you as medical professionals now. We're entering this, what they're, I guess, calling phase 1 of the reopening, the restart of the economy and things. I was at the grocery store last night, and the missus and I, and it said they had a sign up that said 164. That was the limit of patrons that could be in the store because of the capacity limitations. Now, South Carolina the governor in particular has been really good, in my opinion, about staying ahead of this and kind of flattening the curve, as it were, for the Palmetto State, especially as compared to somewhere like Georgia, where they were a little slower to react to the pandemic. Now, will this, even if people take precautions, wearing masks, hand sanitizer, all the steps that the social distancing, everything, will this in any way undo that curve flattening that we have experienced here in South Carolina?
Well, that potential absolutely is something to be concerned about. It definitely can happen.
How do we prevent it? How do we keep the curve flattened and still get back to normal?
Well, there's 2 ways to do it. One is for everybody to stay home and have no connections with the community.
Well, that's no fun.
Well, that is no fun. And the other way is for people to come out, go to work, engage with their community as they are comfortable with. But for those that do, to have the discipline to be personally responsible. And it's not that complicated. If you feel well enough to engage in your community, I've told my patients, you need 2 things with you at all times right now. You need a mask, and you need a small bottle of hand sanitizer. It doesn't mean you have to wear your mask all the time, but you want to have that with you in case you find yourself in a setting where you'll need that. But if you have hand sanitizer with you and you have a mask, you're really prepared for a lot of situations.
Now, do you think people should still be, like, whenever they go out shopping and things, should they still be disinfecting items that they bring in, like groceries and things? Should that still be happening?
It's understandable where those concerns came from, because we all heard about how long this virus could stay viable on certain surfaces. Some things, particularly smooth metal, up to 48 or 72 hours. But I don't think there's been a lot of evidence of transmission from touching an avocado. But it's still an unknown. Personally, in my house, we have not wiped everything down. But I don't have the information to tell somebody that that's not wise. It's just something that I think a
personal preference, maybe.
A personal preference at this point.
Okay. Well,
and one of the things too, as we talk about the masks, and as Dr. Swann mentions, we've got to do our part. There's things that we can control, and there's things unknown, and there's things outside of our control. I mean, we can control getting out and about when we have cold-like symptoms, and we've all done it. I do it, and some of us kind of wear it as a badge of honor. That, man, I'm not going to let it hold me down. I'm going to, I've got the sniffles. It could be an allergy. I've got runny nose. I've got this. I think we need to really ask of our patients and our community, don't go out if you have these cold-like symptoms. Take this seriously. Really do that extra job of washing your hands before you eat, before you leave the bathroom, before you do all these things that just are common sense, but we have done a better job of staying on top of these. And when we're in the clinic, for instance, when we're wearing our masks, and we're wearing our masks when we're in the clinic, even our front office is wearing masks, even our billing office when they're getting out into the patient care area, if they're going to pass a patient in the hallway, they're wearing masks. The thing that we have to consider is we're going to have a shortage of surgical masks. We don't have to have the N95s, and Dr. Swann will be the first to tell you, don't go out and try to get an N95 mask to go out and be a part of the community.
Now, David, I'm glad you said that, because I wanted to ask you, one mask from another. I spent, I think, $29 on a Yeti-like thing that you wear when you're out on a four-wheeler.
Yeah.
Is that any better or any worse than a scarf or a bandana or a surgical mask?
Well, I'll let Dr. Swann speak to that, because he's done a really great job of educating on mask wearing and what type of mask.
Sure. I'm definitely a proponent of masks, but because of what we've learned about masks. So there's no doubt that the N95 masks are the most effective, but most people will learn that if you try to wear an N95 mask for a longer period of time, it's not very comfortable, but it certainly is the most effective. The next would be a surgical mask, and then after that would be a homemade mask. But I was really convinced by reviewing some information that I saw emerge maybe 4 weeks ago about how effective imperfect masks can be. And it all has to do with how likely we are to spread disease. So if an N95 mask, that number, N95, what that means is it filters 95% of very small particles. And this virus that can be suspended in the air would fall into the category of a very small particle. And if you use something like a T-shirt, while that doesn't filter 95% out, it may filter 60 to 80% out. If you throw a coffee filter in there, some of the ways people are becoming more sophisticated making masks, you make that mask even more effective.
Now,
so that's the first thing.
Oh, go ahead. I'm sorry.
It doesn't get us. It's much better than nothing. And even 10%, if it was only 10% beneficial, it would still be worth considering. But the other part to understand about how this is transmitted is that much of it is not in very small particles. It's actually in droplets, which are larger particles. And your T-shirt, your paper towels definitely can prevent droplet particles from reaching your respiratory system. So the homemade masks can be powerfully effective, but even if they're imperfect, what makes them powerful is when your neighbors are also wearing them. And so how many people choose to do this in public is the key for an imperfect mask doing the job for us.
What about a face shield? I've seen people even wearing helmets, like motorcycle helmets, and I think I saw something similar to like a homemade welder's helmet. It was made out of plastic and a headband. I mean, is that as effective as a mask that would filter out?
It wouldn't be as effective as a mask that covered the mouth, because when that person, if there's no shield over their mouth and nose, the air that they're breathing is just filtering around their shield.
Gotcha.
Now, it would probably protect them from the droplets, but it would not catch some of the very small particles that could work through the air around their shield. Now, if you have a mask on and a shield, that person's not getting sick as long as they clean their hands. So it's probably much more than is necessary, but it would work.
Well, that's good to know. I mean, but a mask is definitely the way to go, and we want to encourage everyone to wear masks. David, Dr. Swann, are there any final thoughts that we want to leave people with before we go today?
Well, from my side, this is David with Excel. My side, we're excited that we're seeing a glimpse of the light at the end of the tunnel, and I pray that light is something that will shine brighter for us, and that's something that we can find hope in. I mean, we've all got hope, and we know that this is going to get better. But I am hopeful that as these elective surgeries start back, I'm hopeful that as we open up these restaurants, that we are going to take action as a community. We have stayed home. We've done the right thing on this phase. Let's not let the next phase be something that we don't take seriously and we don't take enough action and then end up setting ourselves back. So I think that taking that personal responsibility, like we've already talked about, washing our hands, staying home when we're sick, wearing masks, but also starting to take back some of that normalcy as well, so that we don't just, as Dr. Swann described, just stay at home and say, okay, well, this is one avenue. I agree, that is one avenue, and we've done that, but we've got to find that way to make our way back out and do it safely.
And my final thoughts to share would just be to really inspire people to do their part. And I remember going into a store the first time with a mask on, and I felt silly. But as I go in the store now, I see more and more people wearing masks. And if we can all just do the right thing and lead by example, that's where our community is going to succeed. And we have to be committed locally. So I just hope everybody is willing to do that. And I think if we are, we're going to do well.
Dr. Ted Swann with Swann Medicine, private practice over in Clemson, and David Bright with XL Rehab and Sports, the most trusted name in Tennessee and South Carolina whenever it comes to physical, occupational, and hand therapy. With a patient-first mission, you can tell that there is a difference. Find out more about them online at xlrehabsports.com. Gentlemen, I really thank you for joining me today. I always look forward to these segments because I always learn something, and today I got a whole lot of wrinkles put in my brain this morning, so thanks, guys, for joining us today on Coffee Time.
Thank you.
Thank you. Nice doing it.
Appreciate it.
Have a good day.
Thanks, you guys, too. And join us again tomorrow for another edition of Coffee Time right here on 94.1 The Lake. Good morning.